My name is Andrew. I'm a physical therapist here at the West Loop. That's where I am right now. I'm in the conference room. No one else is around me right now. But yeah, I'm a physical therapist here. I also do dry needling, as you can see down here. And today we're going to be talking about exercising with low back pain. It's going to be more about, like, everyone's different. Everyone responds differently to, you know, different techniques and kind of like how you move your body. And so we're going to talk pretty generally about ways that you can kind of find what works for you. So we'll get started. A couple of notes. We have our panelist, Michelle. She's going to be answering questions in the chat. So during the presentation, if you want to put your questions, anything that you're wondering about in that chat area, then she will be answering there. If she finds it relevant, then she'll also interrupt me. I've given her all that permission and everything, and so she's gonna just interrupt and say the question out loud and answer it for the group. Also, if you could locate the polling button, there's just going to be one poll question in the middle of the webinar. I think that's it for notes. Hope you're all doing well through the snowstorm. Hope you're all doing well through the pandemic. And let's get started. So again, we're going to be talking pretty generally about low back pain and exercising well. Dealing with that, and that's where this general principles and guidelines is. That's going to be the meat of the presentation. And before that, we're going to talk a little bit of anatomy, and after that, we'll talk risk factors and recovery. Okay, so to start, just really quickly, lumbar spine anatomy. We have our vertebrae; those are the bones that house the spinal cord, and it offers protection for the spinal cord. The spinal cord and the nerve roots, that's the connection between your brain and the rest of your body. And for the most part, we're going to be talking about like muscles, right? So like the brain body connection, spinal cord and nerve roots deliver information there. Foramina, those are the windows, these little windows that you see where my mouse is, where the nerve roots come out from the spinal cord. Okay, and that's going to be important a little bit later. And then the discs provide cushioning for your spinal cord, or for your spine here. Okay. All right, so the first kind of like condition, if you want to call it that, that we're going to talk about is discogenic pain. That's pain that is due to the disc. So generally you hear about, oh, I slipped a disc. Slipping a disc is not exactly what happens. It's more of like a herniation where this more liquidy solution in the center of the disc pops out due to pressure or due to like weakening of the outer region of the disc, or both, combination of factors. And then that presses against the nerve, and that's when you get some of that pain down the leg, or pain localized to that region. Okay, so that's a disc issue. You can also have degeneration of the disc, where the discs actually can kind of like wear away and lose height, and that can cause some pain as well. These people tend to prefer bending backwards. So if you have a disc issue, normally like bending backwards will relieve some of that pain. Okay, and here's a GIF that shows sort of that mechanism of how that pain happens. You can see it's kind of like a jelly donut with the liquid center. And if you, over here on the left, that's the front, and on the right is the back. So you can see that you might bend forward. You might bend forward in kind of like a wrong way, or your disc has just kind of weakened over time, and you bend forward, and that liquid can pop out and cause some pain against the nerve root there. All right. Next, we're going to talk about spinal stenosis. This is one of the diagnoses that it actually feels better to bend forward, okay, or to slouch. You might find that slouching feels better. And this is when those windows, we'll look here, these windows where the nerve comes out, it becomes narrowed. That's spinal stenosis, okay? And with that narrowing, you can see that there's pressure on the roots, the nerve roots coming out, and that causes some of that pain, either locally or down the leg. And with this flexion, it's been found that it increases space for the nerves, for the nerve roots by up to 30%, which is why you can see that it's a very relieving motion for some people, or most people. Okay, so again, if you have questions in the chat. All right, next we're gonna move into general principles and guidelines. This is our table of contents. We're gonna talk about that coming up. So first, keep moving. You hear it all the time, like sitting is the new smoking. Make sure that you're changing positions often, right? And a good way to do that is to just kind of like set a timer and to just kind of remind yourself, right? Every 30 minutes to an hour, you want to kind of like change position, either go from sit to stand or stand to sit, take a short walk, maybe go to the fridge, get some water. And what you're trying to do with this is to combat stiffness. And stiffness is often a precursor to pain. So it can kind of be a warning sign, and you want to deal with that stiffness before it turns into pain. Also, by moving, you're going to be combating hip flexor tightness. So you can see in this sitting position, these muscles that flex your hip, right? By sitting for prolonged periods of time, it stays in a shortened position for a long time, and it can tighten up over time. Okay, and then if you look in this diagram to the right, if you have hip flexor tightness, it tilts your pelvis forward, right? You can have some of that anterior pelvic tilt, which can cause tightness in your low back. Okay, also with that tilt, you can see that your abdominal muscles and your glutes would be a little more stretched out. If they're a little more stretched out, then they can't activate as well and they can't do their job. You're going to have some weakness there. You're not going to be very stable in your low back. So those hip flexors can be very important in helping to relieve some of your back pain, right? So if you can keep your hip flexors loose, it might help with some of your back pain. Okay, and then secondary benefits to moving: decreased risk of heart disease, decreased physical and mental stress, and then also decreased risk of death, very important. All right, pain during exercise. So you want to listen to your body. That's the main thing, right? So you want to make sure that if you have excruciating pain, right, or you have pain going down your leg, maybe try something else, right? Stop, try something else, stop, get some help. Maybe try some physical therapy, okay? But it's just, you gotta listen to your body. And if you do need to do something, try to keep your pain manageable here, okay? We have this pain measurement scale. Generally, a 3 out of 10 or lower is gonna be in this mild range, right? So we wanna try to keep our pain on the lower end of things, obviously, but like that 3 out of 10, you're less likely to cause lasting damage, okay, if you keep the pain low. Because pain is just your body warning you that something's wrong. Also, if you do have pain, you want to keep it in your back. You don't want to have pain going all the way, going down your leg. You don't want it in your calf. You don't want it in your foot. Okay? You want to keep it in your back as much as possible. And we're gonna talk a little bit about some techniques that can maybe help you do that. And that's here, directional preference. So most people present with either a flexion, right? So you can look at me, make sure I can see myself. Okay, either a flexion preference, bending forward, or an extension preference, bending backwards. Okay, and by preference, I mean like pain feels better, either pain feels better or you have more centralization. So if you look at where my arrow is, centralization where your pain is coming center, okay? The opposite is peripheralization where the pain is going away, okay? You want to keep that pain close, close to your back as much as possible, okay? So that's a preference, decreased in pain or increase in that central pain. Okay, so if you have the means, I'm going to share this poll really quickly. Okay, so a poll should have popped up. If you can stand up, if you have the means, and kind of like do a couple extensions, maybe like 5 or so, just light extensions, and maybe some forward bends, okay? And just see which one feels better for you. Are you a flexor? Do you prefer flexion, bending forward? Or are you an extensor where you prefer bending backwards? Okay, maybe both feel good. Maybe both hurt. But if you can just quickly answer the poll if you can, and we'll see where we stand. I think I tend to prefer flexion. Great, thank you all for answering so far. Looks like we've got flexors and also some both feel good. That's good. Great. Okay, so if you have more of a flexion preference, then maybe, you know, like bending forward opens up that space in the back of your spine and that feels better for you. Whereas if you have an extension preference, the one of you that has an extension preference, it's potentially disc related. Can't say for sure, but that's one of the factors that we look at. And then both feel good. That's a good sign as well. Okay, I'm glad that at this moment, no one says that both of them hurt. It can affect the prognosis a little bit if you have both of them being a little painful. Great, thank you all for your participation there. Here are some examples of what someone with a flexion or extension preference might look like, or what they might prefer. So if you prefer bending forward, sitting might feel better for you. You know, it might feel better to sit at your desk and work. Bending forward, of course, and then lying on your back with your knees bent, right? If you find yourself lying on your back and then like having your feet flat and your knees bent, then maybe you're a flexion preference. Extension people prefer standing generally and bending backwards. They also, if they're lying on their back, they prefer their knees straight for the most part. And then also lying on your stomach, right? Maybe like a sleepover where you have your hands, where you're propped up on your elbows and you have your hands under your chin, that might feel better as well. Okay. So what can we do with that directional preference? You can kind of, you might be able to leverage that preference as your treatment. So if you have higher levels of pain, you might benefit from doing a lot of reps of pain-free, or low levels of pain, either like forward bends, back bends, or like easier alternatives, right? So since most of us are flexion preference, so this might get too intense. It might be too much to do 100 of these a day, okay? So what you could do is like do sitting and like bend forward, right? Maybe like while you're working, if you start to stiffen up a little bit, or you walk and you stiffen up a little bit, maybe you like have a seat and do a couple forward bends. Okay, and doing a lot of reps of this might be a way to alleviate some of your pain. If you're someone who feels better extending, then maybe standing extensions. If that's too hard or too much, then maybe doing like press ups, keeping your hips flat, so like lying down on your stomach and doing press ups like this. Okay. And then if you maybe are dealing with just a little bit of pain or some nagging pain, lower levels, then maybe you can just work in a couple reps between exercises. Okay. And actually that's what these examples are below. So for example, if you're squatting, let's say at the gym, or doing some bodyweight squats at home, right, which is more of kind of a flexion type movement for your low back, then between sets, you might do some back bends to kind of cancel out the flexion. Okay. And then oppositely, if you're someone who prefers flexion, between sets of bench press where you might be more extended, right, in your low back, pumping out some bench presses, then between those, you might do some forward bends, kind of like touching your toes. Okay. But remember, always do what feels good and avoid what feels bad. That's a good general principle. You want to listen to your body, and don't do stuff that hurts. That's your body telling you try something else. Okay. Next, you can use some muscular engagement techniques or cues to maybe turning on certain muscles helps you to perform activities that were previously painful without pain. Okay, so one is glute engagement. So that's what we're seeing in the bottom right here in the picture. So you squeeze and tuck your butt under you. Okay, so maybe you have a little bit of this tilt forward with your pelvis. You want to tuck your butt under you, and you can kind of like poke, right? Poke your butt before, poke your butt after, and you'll notice that it should get a little harder, okay? And that means that your glutes are engaging, okay? And then core engagement is where you like brace for a punch. So turning on your core can help protect your low back, okay? And you can also try maybe just doing it a little lighter, seeing if that works for you as well. Just pressing your belly button lightly towards your spine. Okay. So those are two things that you can do when you're running or when you're jogging or doing some other type of exercise. Turn on your glutes, turn on your core. They found that those will provide more stability for your spine. Okay, and then warming up. Warm-ups have been shown to improve performance, and then they also possibly have found reduction in injury rates. So I think it's worth warming up, right, in case that it actually does decrease your injury rate. It also feels good to warm up. So all you need is about 5 minutes of a warm-up. They should be light activities, right? Here's some examples like walking, elliptical, lunging, doing some back bends, the ones that feel good, some cat-cow. You can also use your lacrosse ball or your foam roller to do some muscle releases. And if you're not familiar with these, you can find them on our YouTube channel. You just literally search React Physical Therapy. And you can play around with some of those that feel good for you. Okay, but just like a warm-up can maybe help to improve some of your pain before you start to do something that's a little more intense. Next sort of technique or principle is a slow progression, right? You don't want to jump into, full out like Orange Theory. You want to like make sure that your body's ready for that. You want to have a bit of a ramp up. Okay. Maybe even if you do go to Orange Theory for the first time in a while, you can still kind of like, I think they have ways to modify some of the activities that you do there. So it's kind of like a trial and error. You're going to have to kind of like see what feels good during, and then also the next day. Like, did you overdo it? Did you underdo it? So you want to find that level of activity where you're uncomfortable, and then tone it down just a little bit. Okay, and make sure to exercise patience. Maybe take a few days to a week before you go up another level. Okay. Some adjustments that you can make to your exercises. So more support. So if you're doing like lunges, and they're kind of hard for you, it might be because it's more of a single leg activity, or like it challenges your balance a little bit. So a step back could be either like not going as deep in your lunge or doing just a squat where you have two legs under you and you're supported and balanced. Okay. Another example, going from like a dumbbell bench press where each arm has to work kind of individually or more individually, to having a barbell where you're using both arms together. Okay. You can also decrease or increase weight, speed, number of reps, and then also the rest between your sets. That can make a big difference as well. So you have all these different, these are just some examples, all these different ways of varying up your exercises, making them easier, making them harder. So here's an example. So if you're trying to get to weighted squats, like full weight squats, you have to be able to do body weight squats first, right? If you can't do a full range body weight squat, then you got to work your way through like partial range of motion until you get down to full range. And then you can add some weight. And when you add weight, you got to progress that as well on top of the range of motion that you're going through. Okay. So let's say, for example, that you have no issues with your body weight squats. Then you struggle with C, your weighted squats with partial range, right? Maybe you go back to your full weight body weight squats, or maybe you put less weight on your partial squat, okay? And then, try again, okay? Then you retest. Okay, so that's sort of like that experiment, that trial and error. Okay, and then an example for maybe some of you are runners, right? Like, you start with a walk and then you go to a walk jog, and then you go from walk jog and then to a full run. Okay, so it's best generally to not go straight into jogging or running if you haven't done anything for a while. Okay, and by a while I'd say probably like a month or two. Okay, so you want to make sure that you progress through the different stages. And then within that, you also want to slowly increase your distance or your speed over weeks. Okay, I know it might be frustrating at first, but it's going to be what's best for you in the long term. Right? Make sure that your max 10% increase in terms of speed or distance week to week. All right, moving on to risk factors and recovery. These are good general principles regardless of whether or not you have pain, and regardless of where your pain is or might be. These are generally good ideas. So they found that there's a correlation between low back pain and stress. It actually is a higher correlation between low back pain and stress than like low back pain and bending, lifting, twisting. Okay, so stress can play a huge part in people's pain. Lack of sleep is also potentially a risk factor. My girlfriend actually, she had low back pain all through college. She was very stressed through college, and then as soon as she got out of college, her pain went away. Right, so that's just one example that you might see. Maybe you can relate to it, but make sure that you're dealing with your stress in ways that work for you. Sleep. Sleep is very important. It's a time when you're building muscle, when your body's healing itself. It's when you recover. And ideally, it would be on your back, but the most important part is that you sleep in general. When you're on your back, you just have more symmetry side to side. So in my opinion, that's a better way to sleep. But again, most important is that you sleep at all in a way that's comfortable for you. Healthy, balanced diet. If you need help, find a nutritionist or a dietitian. Monitor how you feel following your exercise. This is what we talked about earlier, right? Where you're just kind of like doing a little self-reflection, like, why am I maybe a little stiff today after the exercise? Maybe I need to tone it down a little bit. Or I feel good. I can keep progressing slowly through my exercises and then adjust. All right. And then when it comes to recovery, right? If you need personal guidance, if you want a personalized exercise program, if you want hands-on techniques, we have massage, we have active releases, spinal mobilizations, we do dry needling, all that stuff. We have a lot of tools in our toolkit to help with pain. If you want 30 minutes of one-on-one time with a doctor of physical therapy, 1 to 3 times a week, please consider physical therapy. Please consider React for your physical therapy needs. And in summary, right, this is just a very quick summary, right? Keep moving, keep your pain low and in the back. Know your directional preference and use it to your advantage. Engage your muscles, right? Engage your abs, engage your butt during your exercises. Make sure you warm up before your exercises. Patient, slow progression, and make sure that you manage your stress. Take care of your whole body, and then consider physical therapy. Okay, and if you have questions, I think that's the presentation here. If you have questions, raise your hand. I can unmute you.
Tim just put a question into the chat box if you want to take a look at that.
Okay. All right. Yeah, so Tim, this is so Tim's question, if you look in the chat, right? Pretty sure he has a bulging disc. He was a big walker prior to this, and then lately, when he walks, it hurts more after. Should he stop walking for a while? Tim, that's a hard thing to answer without seeing you in person, but I think that you can. I don't know what you've done in terms of maybe decreasing the amount that you're walking. Obviously, you got to walk to get from place to place, maybe even just around your house. But yeah, if you can just kind of like pull it back a little bit and try to find an amount of walking that works for you, I think that's a good way to kind of like deal with what you've got going on. And if you can get to a physical therapist who can maybe do some hands-on stuff to, why can't I talk? Clicking up the healing process, then you should consider that. Michelle, do you have any thoughts on it, or are you good?
Yeah, so I think the way that you presented, like looking for a directional preference, how they can do that on their own, meaning do some forward flexions a couple of times, stand back up straight, see if the pain goes away, or if the pain is still there, try bending backwards repetitively a couple of times, stand up straight, see if it goes away. The other thing is, if one of those seems to work for you, stopping during that walk and performing just a couple of those flexions forward or bending forward or a couple of those extensions backwards while you're walking to get the pain to be more tolerable so you can still increase that distance. Try that. But just like Andrew said, it's much easier for us to look at you and tell you what your directional preference is based on how you present when you come in for an evaluation. That would probably be the best way to kind of diagnose what's going on with you. It's kind of hard not to be able to see you, but you can try doing that.
Oh, you're already working with Caitlin. Great. Yes. Okay. Oh, and also for everyone, we also do free screens. So if you do have any, if you want someone to look at you pretty quickly and give you just an overall kind of assessment, we do free screens. They're usually about 15 to 30 minutes. Tips for a scoliosis diagnosis. So tips for a scoliosis diagnosis. I've generally, with scoliosis, kind of done the same thing where you find a directional preference and work into that. But another thing that might help is improving the mobility in your upper back, right? So your thoracic spine, so just above the low back, all the way up just below your neck, right? So your thoracic spine is about that much here. And something that you can do for that are maybe some open books, right? Rotations, lying on your side. Okay, I'm gonna lie on this dirty floor here, but right. So like keeping your knees together and rotating your back. Try to have your head supported, maybe on a pillow or a foam roller, right? But improving mobility in your thoracic spine could also help with your low back pain, potentially due to scoliosis. Okay. Rocio, hi Rocio. She says, what's the best way to sit and work on a laptop to avoid low back pain? So I think this goes back to what I said earlier, where changing positions is the best way to kind of deal with that and kind of prevent that. So whether it's going from sit to stand or stand to sit, and if you have like the means, if you have a stability ball, that's another option. You can kind of like cycle between the three. But you also want to make sure that your setup is conducive to work. So right now, I'm looking too far down, right? I'm leaving myself open to neck pain. And then, so if, let's just say your laptop should be about 10 degrees in this range of about 10 degrees down or 10 degrees up. So a total range of about 20 degrees, okay? Because if you're looking too far down, it's gonna put pressure on your neck, and then your weight is forward, and it's gonna just put more pressure throughout your entire back here. And your body is just, everything's connected. So if you have, if you're leaning too far forward for too long, then it's gonna naturally put more pressure on your low back here. Okay, so I mean, for the most part, just vary it up, and then otherwise try to, generally sit with good posture. Actually, Michelle has told me, I don't want to call you out, but she did say that for people who have like a flexion preference, slouching might feel best. And so, if it hurts to sit up straight, then maybe it's not right for you to sit up straight. Okay. So find what feels good for you and try to have your monitor in this 20-degree range, 10 degrees up or 10 degrees down. Okay. Hope that answered, Rocio. Stenosis leads, hi Barbara, stenosis leads to heavy leg weakness. Flexion is your preference. What else can you do for the one leg weakness? So Barbara, do you definitely have stenosis? I guess that's one of my questions. This might be something that you'd want to get checked out in person. Okay, diagnosed stenosis, one leg. Interesting. Okay, cool. Okay. This would definitely be something that you'd want to get checked out in person. In terms of, in terms of giving medical advice, it's hard for me to do. I hope you can recognize that here. But you do want to try to leverage that flexion preference as much as you can, as long as it remains relatively pain-free and your pain stays, if you have pain, in your back rather than down your leg. Okay. So I'd say the first thing that you'd want to do is maybe some seated forward bends, okay, 100 to 150 times a day, okay, spread it out throughout the day. I think that would be a good place to start in terms of trying to create a little more space where that nerve is traveling out of your spine. Yeah, hope that helps.
I think some core activation as well, like some transverse abdominis activation on your back, and then progressively doing that in different positions like sitting and standing may be helpful as well.
Mhm. Yeah, and that's spelled, I'm going to type it here. Transversus abdominis. So you can, like Michelle said, like start easy and work your way up a little bit with those activation exercises. It's not gonna, it generally doesn't feel like you're doing much, but it's very helpful. Just low level activation of your transversus abdominis.
And then Stacy raised her hand, Andrew. I don't know if she has a
Oh,
question.
did she? Let me do this.
We're
Raise
good.
her hand. Okay, we're good. Okay. All right. Thank you all very much. Thank you all for coming. Hope you stay safe. These the slides will be emailed to all of you. So thank you all very much for coming. Yeah, stay safe through everything that's been going on. And yeah, see you later.